Good day to everyone. Thank you very much for this opportunity to be with you today. I'm very happy and I hope you will enjoy the presentation. If you allow me, I will share my screen with you. Let me first see if I can manage the okay. Let me go to the first page. Sorry for the problem. So today I will talk about economic consequences of COVID-19 and suggestion for survival. This was a suggestion by Dr. Demir. I'm very grateful for his kind invitation. And you have my email address there, and I will share this file with you. I sent it to Dr. Demir to make it available to you. It contains lots of information. I might not be able to go through all of it, but it will be available to you. So my focus today is on socioeconomic consequences of COVID-19, economic consequences, business and labor market effects, and also some other effects. So my job here is not really to do research about COVID effects, but rather summarizing what I found covering this area. First, I show you a table about the situation in MENA region. You can see this is a table that is provided internationally, and we can see in terms of number of cases, Turkey and Iran, Israel and Iraq are the countries that they have most cases. But again, then they differ when it comes to, for instance, cases per million. That is, for instance, country Israel, Lebanon, Qatar, and Bahrain. They are the ones that have highest number. Then in terms of number of deaths, again, is different. Iran is one of the highest. Then we have Lebanon, we have Greece, we have a number of countries that is highest. In terms of tests also, as you can see, this column is different. So it means there is a difference in number of cases, number of tests across countries in the Middle East. And you can see this from this table. Then my first part of presentation is about socioeconomic consequences that I have reviewed the studies from US, Kenya, general global, UK, global, US, and Sweden that are related to these socioeconomic consequences of COVID. The first study is by Baum, that is about US. It talks about the spread of COVID that has influenced by geography and proximity to areas with high concentration. And it looks at confirmed cases for the counties in 48 states of US. So the data is at county level, basically the study. Then it looks at COVID health risk index, that is computes such an index that accounts for instance, obesity, diabetes, high blood pressure, and heart disease and chronic disease that may aggravate the negative effects of COVID-19. Otherwise, is interested in population, gender, race, age categories, and socioeconomic factors, and also even looks at information about health risk factors, this study. Then it considers a number of stylized facts, that it shows that males are more resistant to observing public health interventions. And then it looks at the minorities who work in essential jobs, that they cannot do it online or from distance, so they suffer most from the COVID. younger individuals are more likely to ignore these protective behaviors. And that led to a number of states, they reinstated restrictions. And then it looks at lower median income that are suffering most from economic effects of COVID because of losers' job or inability to work. Then it looks at healthcare facilities. That is the important factor that differs from one geographic region to another. It looks at higher level of air pollution that differs by different counties. It looks at lacking health insurance for the population that have no access to health insurance. Then it looks at complicating health risk factors, those 5 that I mentioned, and also looks at whether these counties are Republican dominated or Democratic dominated, because Republicans, they were pro openness, and Democrats, they were for protection and lockdown. So that was about the study about US. This study is about Kenya. Mombasa is a coastal city of Kenya that is a touristic city. It's assessment shows that 17% of respondents, it was a survey, that felt that their COVID experience have prepared them for another similar crisis in future. 57% felt that they were not prepared. And out of these people who were surveyed, 60% they have full-time employment. It means more security than part-time or no formal employment, informal employment. And the city has account for 43% of occupied beds. And they noted that access to running water, electricity, healthcare, and accommodation services showed to be very vital during the coronavirus, but especially for the hospitality industry, which is similar situation in most countries when it comes to COVID and its effect on hospitality industry. This study, it starts with that effects of health and socially from COVID-19, it's underestimated because of unavailability of statistics and direct interaction with the surveyed people. It looks at experience from previous work and reflected in the decision making, and it examines research and danger observations, social setting, science correspondence, adjusting individual and aggregate interest. And at the end, it looks at what have we learned to be able to utilize for upcoming pandemics and their effect on well-being. So this is also one study about socioeconomics. This study by Wittreven, it looks at financial stress, and it gives example of UK, that in UK, the state or the government secured temporary 80% of regular pay, at least for those who were employed, and employees were at risk of reduced work hours, income, and job loss. So 80% security was quite significant for those who had regular employment. Then it looks at UK household survey data that it uses. It is a very famous survey and publicly available. They have added aspects that is related to COVID. The result indicates that lower earning groups were more than twice experiencing economic hardship relative to top quintile earning, those with higher income. The gap was attributed to gender earning inequality, and also women and racial ethnic minorities who are employed in essential jobs that need to be done. You cannot postpone or move to distance, so they were suffering more economic hardship. This table, it shows the effects of different factors, and all the time shows that there is a negative effect on all of those, and COVID on those different earning groups, but the effect differs from one group to another depending on their place in the distribution of income. This study is a review article that it looks at economic crisis and recession and how it has affected people, especially looks at social distancing, self-isolation, and travel restrictions that had led to many job losses. And the development has been more oriented toward medical supplies in production during the COVID. And it looks at the role of leadership in healthcare to be able to facilitate provision of health services to the general public and also especially to those with intensive care treatment. Then it looks at medium and long-term planning that is needed to rebalance and re-energize the economy following this crisis. And it emphasizes encouragement of entrepreneurship needed so that create robust and sustainable business models can flourish. This study is about 3 self-protective behaviors in US. The first one is changed behavior to be self-protecting. Another one is increased social distancing behavior. The third one is increased hand washing and mask wearing. Then it looks at socioeconomic differences in explaining this behavior and factors like income, gender, race, and work arrangement and housing quality. Then it looks at the heaviest burden, and those measures are placed on those who are already suffering most from the pandemic. And the area that policymakers is recommending to emphasize is to focus on is access to open air, for instance, that could reduce social distancing needs. Access to telework will lower self-protective behavior needs, and government can offer direct monetary support to citizens who are in the need of economic support. I have the only study that I have done related to COVID is the spread of effects of COVID being different in different locations. So the differences can be partially explained by socioeconomic and demographic characteristics of the population. Then we look at 292 municipalities in Sweden, or 21 regions, and we observe them from March to January 2020 to January 20 on a weekly basis. So we have about 45 weeks of data. We look at the effect of COVID is divided between negative effect. This means the number of cases infected, number of cases death, and positive effect, that is like those who recover and those who get intensive care unit treatments to recover. Then we employ regression analysis and estimate efficiency of those municipalities in management of COVID. And we explain these differences in efficiency related to their socioeconomic and demographic characteristics of the population and business. Here is, we aggregate those cases of COVID-19 with based on different provinces, and you can see some provinces are have very high rate of cases, and then this is the cases of death, and you can see the development of cases and death over about 45 weeks. And this is like the first wave, this is the second wave of cases, this is first wave of death and second wave, and we are in a stage of probably facing a third wave. The efficiency of municipalities in coping with or management of COVID differs a lot. Like this municipality is 90% effective, but there are some municipalities that are only 21% effective here. And there is another one which is 25. So this means efficiency differs, and not because they want to be inefficient, but because of circumstances that they have. And this efficiency can change positively for some of them, but some of them, the efficiency deteriorate. It shows is in negative. And here you can see over time that efficiency was higher in the beginning, but become lower and lower gradually. And this is on different month is about 50 to 60 to 70% effectiveness. And again, some months has become negative changes, some months it has become positive changes. So the situation has differed both over time and across municipalities. And here provinces are ranked by level of efficiency. So this means this one is like 90% effective, and it doesn't mean 10% inefficiency every week, but this is the average of the weeks. And you can see the worst performing one are those four last ones. So this means the policies that are used in the efficient one, if applied to those with inefficiency, then it will lead to, in general, the degree of efficiency will be high for the whole nation. And this one shows those who improve their effectiveness in managing COVID and those who deteriorated their efficiency for some reason. So that was about socioeconomic consequences of COVID. Now I move to economic consequences. From global, we have several studies, then we have US and Canada. And the first study is basically by Jordan and others, which looks at medium and long-term effects of pandemics. How do they differ from other disasters that humanity has faced earlier? Looks at major pandemics from 14th century. And I will show you how long they lasted and what they were. And it compares those pandemics with a new classic economic growth, because economic growth is very important during and after pandemic and crisis. So it looks at those to see what we learned from the past. It finds that this is a number of pandemics that with at least 100,000 deaths. And the last recent one is swine flu from 2009. We don't have registered later than that, because this paper was published in 2000, not recently. And then some pandemics, it took like within 1 year vanished, like swine flu, but some others it took about 25 years. And the number of that also has been different. You can see it from here. This is 100,000. Most of them, that is a minimum. And the others is up to 1 million or more than 1 million deaths as a result of those pandemics. So the worst one is this Black Death, 1331 to 53. And you can see that it has lasted like 22 years. Then we have a Spanish flu. So those two are the most serious pandemics that humanity has faced. And it compares the differences between war and pandemics. War is very destructive, but once the war is over, people start rebuilding. The process is more smooth, but pandemics is not like war. It doesn't destroy capital, but it influences the human capital and workforce. And it lasts for 3-4 decades before it vanishes, the effect. So pandemics is more serious than war. The difference is basically during pandemic, wages are not changed, but during war, they are changed. And capital is destroyed during war, but not during pandemics. Then another study is about measurement error, that COVID's data usually are subject to measurement error. When it comes to social distancing, we can like monitor people using GPS, but still measurement error in data is a big problem. Policy measures related to COVID is important area of research that this study tries to highlight, and health and economic policy stimulus measures and provide review of policy determinants. It looks at what is optimal lockdown measures, factors that affect lifting the lockdown, and combination of fiscal and monetary policy to reduce the negative effects of COVID pandemics. Then we, in this study, we look at economic policy responses to COVID-19. And those are, for instance, it's about data from 168 countries that looks at the effects, economic policy responses to COVID. It looks at measures of economic stimulus, how to measure it. And the results show that Chile, Switzerland, Croatia, Sweden, and Netherlands responded more strongly than other countries to the pandemic. And it does also some better regression analysis to show what is the effect of this economic stimulus, how to measure them, and what is their effects. Another study that is from 2020, it examines the short-term consequences of COVID. It looks at, for instance, employment and wages in US. It finds that COVID-19 increased unemployment rate. It decreased hours of work and labor for participation, and had no impact on wages almost, because wages are rigid and do not change short-term. The negative impacts are larger for men, younger worker, Hispanic, and less educated workers. And it has led to increased inequality in the society. It built 3 different indexes to look at this employment and short-term employment and wage effects. And those are workers relatively more exposed to disease, looks at their situation, workers that work with close proximity to co-workers, and workers who can easily work remotely. And it looks at suggests individuals in occupation working in proximity to others are more affected, while occupation able to work remotely are less affected in short term by COVID. This study is about a similar situation in Canada that looks at labor market in Canada, build again different indexes, is the same author, build the same indexes and looks at negative effects of COVID and labor market outcome. And then we go to this study that looks at economic consequences of COVID and government response to this situation. It provides overview of data sets that are used to measure social distancing. It reviews the literature and the determinants of compliance with and effectiveness of social distances, summarizes the literature and the socioeconomic consequences, and also discuss different policy measures. It come up with this table that it shows different types of policy measures that is used around the world. The total number implemented policies looks at the number of countries which have implemented those policies and their stringency, how serious they have been taken into account. For instance, those with highly serious is new task force for configuration of administration to tackle pandemics, and also these emergency decisions. But then some measures is used by 186 countries, some measures by only 99. But you can see that it has been very intensive use of these kind of policy measures globally. The third area, it's about business and labor market effects that I have studies from Italy, US, Japan, Australia, and Asian countries, and also global situation. The first study, it looks at executives of industrial firms in Netherlands, in northern Italy, their view about the effects of pandemic. It looks at the importance of servitization of business model. That is something very interesting to your researchers at your university. Then it looks at 4 stages of crisis that it discusses: calamity, quick and dirty, restart, and adaptation. Then it looks at how servitization can enhance resilience for future crises and providing indicator of the role of service operation. It indicates 3 positive thoughts, that is optimism, collaboration, and also digital readiness that could ease the impacts of COVID-19 or any other crisis in future. This graph, it shows basically digitalization programs pre-COVID, those green areas, and post-COVID, that is expansion of these dark areas. So it means COVID-19 had a positive effect on this digitalization of the economy. Then we look at this study that it looks at Australia's economy. And look at labor market shocks in Australia, how it has affected business closure and social distances. It looks at data that is based on 2,078 Australian residents and studies their financial well-being, and that is related to reduction of earning and work hours and entry into unemployment. And then it looks at large inequality that this labor market shocks has created. And using this sample, it makes inference about the society. And then finally, it says it is necessary to reduce unemployment, underemployment, and also restore labor force participation confidence and provide social safety and financial counseling also to the citizen. This study is about restrictions and demand shift that is during the COVID are expected to shatter many small businesses and looks at their effects. It looks at the number of active business in US plunged from 15 million to 11.7. So this means 3.3 million businesses were shut down because of COVID in 2020. And that is 22% of business. If we compare it with Great Recession in interwar, it went down with 730,000 or only 5%, although the Great Depression lasted for some years. So it means COVID is much stronger negative effect on business than it was Great Depression. Then it compares different societies. It can see that African American businesses were hit especially hard with 41% drop. Latinos, they dropped by 32%, the Asian by 26%, and then immigrant business owner experienced 36% drop, and female-owned business 25%. So there is a difference in the different groups suffering when it comes to exit a firm in US because of COVID. This study looks at firm exiting the market in Japan, and it finds that sizable heterogeneity in number and rate of exit across industries and locations. And that exit rate differ on average is 20% in Japan, but it varies from 10% to 110% exit by location and industrial sectors. So those increases are mainly due to, in exit rates, mainly due to expected sale growth rate that it went down. Then it mentions also about government support subsidies to firm survival. This is the COVID period in Japan, England, and US, and the number of exits from the market and economic difficulties, liquidation, that it shows that all countries are affected more or less. Then we have regional integration in Asia that they think there is examines the effect of regional economic integration on trade in COVID-19 products for Asian countries between 2010 and 2020. And it finds that bilateral trade in COVID-19 products, only COVID-19 products, reveal that Asian Regional Trade Agreement is stumbling block to the World Trade Organization rule-based multilateral trading system. And this paper is about firms around the world and looks at World Bank collecting enterprise survey data from different countries. So it's studied based on firm difficulties around the world using this World Bank survey. And we can see that it finds that the pandemic impact has been swift, large, and different across different country locations and also industries and population subgroups. The pandemic negative effect on export are greater than those on domestic sale. And pandemic effects are very heterogeneous across countries, industrial sectors, and regional location of the country. There is a number of effects also that is about, this is about worse in the winter and better in the summer situation, health strategies of the population, and also presidential election in US. The weather condition, it says temperature and humidity are important when it comes to transmission. And it shows the analysis based on 1,236 regions globally, which covers 124 countries, and it uses GPS and satellite to be able to collect information. The results show that temperature and relative humidity are negatively correlated with COVID transmission. And government intervention and lower population movement have contributed to decrease in new cases. But now we are in stage of facing a third wave, but we are moving toward spring and summer. But the weather conditions are not decisive factor for COVID transmission, because government intervention and public awareness also can be very crucial factors when it comes to reducing the transmission. And it shows that this is humidity, and this is relative humidity, and this is temperature. And you can see that high humidity and high temperature, they reduce the transmission. But there are some factors that increasing it. For instance, lockdown decreasing the transfer, but increasing in the school population ratio, labor market participation, and population concentration, they increase the transmission. This study is about health strategies. Is from Italy, this Modena province that was one of regions in Southern Europe that faced COVID and lockdown and negative effect heavily. It talks about how they managed to cope with the situation and recover from it. It gives example of collaboration between public, state, and healthcare system. This study is about US presidential election it shows that COVID-19 negatively affected the Trump vote. And if the COVID-19 was 5% lower, the rate of cases, and so Trump would win the election if it was 5% lower. And it looks at the differences in the states and demography, which COVID affected voting. And I have summarized the socioeconomic consequences, economic consequences, business and labor market effects, and also other effects. So I will send the PDF file to Dr. Demi to make it available to you for those of you who have interest in reading more in detail. I thank you for your attention, and now I'll be available, have a few minutes more to answer if you have any questions. So thank you very much. I cannot hear you.
Can you hear me, sir?
Yes, I can hear you.
Sorry. Thank you very much, Professor Dr. Almas
you.
Heshmati, for your very valuable presentation that I have learned a lot. Actually, it was very informative. Before I ask some questions, I would like to ask from participants whether they have some questions. If you could just raise your hands, I would give you. Noanko Ifan, if I could pronounce your name, could you please ask your question? I think you have a question here. Anyone has question, you can just turn on your mic and you can ask the question. Okay. Professor, I have a question to you.
Please.
Actually, you have mentioned about the decrease in the small and medium enterprises and the COVID-19 progress comparing to the Great Depression. So what do you think the reason is? Why today there are more closing of small and medium enterprises comparing to the previous global crisis?
It's basically probably when it comes to small businesses, in the past, they were many of them family business, which they have a stronger survival compared with if you have employees that you have downsized and gradually probably not be able to pay the rent and shut down the business. That is one of the reasons. Another one is probably it's relatively easier nowadays to shut down and migrate to another business area, but the exit rate, of course, is very high. But there might be more flexibility when it comes to starting new business.
Mm-hmm. Thank you very much, Professor. There is one question actually is asked by the participants that may you able to share your opinion about those industries that benefited by COVID-19, such as the retail pharmacy business, asks Dr. Lim.
It's digital businesses and pharmacy, they have gained a lot. Then, of course, retail also, for instance, online trade has increased dramatically. Postal services, there is a number of areas that they have gained significantly. I would not expect that like a health medical pharmacies to lose the gap and selling more because they are profit making, they are for profit, and they may wish to stay much longer time in the business by selling vaccines and different kind of products to reduce the COVID infection and transfer. Probably they do not wish to come up with solutions that solve the problem once for all. They might wish to stay in business. But digital is the area that they have gained a lot, and probably we will not be able to go back to the old level. So we have to stay with it.
True. Thank you very much, Professor.
Thank you very
I know
much.
that you have another meeting today. You have shared your time with us.
Yes, thank you very much for this opportunity to be with you. I am very sorry I went through the presentation very quickly, but I sent you the file to make it available for the participants.
Absolutely,
And
sir.
my
I will share
emails
it with
is
everyone.
also there. If someone wants, you can always write to me. So it has been a pleasure to be with you. Thank you very much,
dear Professor.
Thank you.
It was our honor to